Hello everyone, welcome to my channel. Today I'm going to talk about different mucosal lesions caused due to viral infections. I'm going to cover HSV, Varicella zoster virus, Measles, Papilloma, and Condyloma Acuminatum, Coxsackie virus, and Hex disease. So let's begin. So first I would like to talk about HSV virus, and if it occurs for the first time, it is called as primary. And if it occurs again, then it is called as recurrent HSV infection. And when it happens for the first time, it is usually pan-oral, and it is a self-limiting disease. Here on the picture, you can see HSV, how it looks like. This is on the lips. Okay. What happens is, when the person is first affected by this virus, you might think that, okay, once it's cured, the person is fine. But actually, this virus remains latent. And when activated due to sunlight or stress or immunosuppression, then there can be a recurrent infection. Okay, that can lead to recurrent HSV infection. Now, it is usually keratinized. It can be seen in the form of herpes labialis. So, let me tell you again. HSV is of two types, primary and recurrent. Primary is also known as herpes labialis, which is pan-oral and self-limiting. And what happens is, when this virus remains inactive and then is later activated because of sunlight or stress, there can be an infection again, which can occur in the form of again in the lips, or it can occur at other places. Also, it can occur in the head. It is called as herpes gladiatorium, and the treatment is antiviral drug, acyclovir. Okay. Now, another type of herpes virus is varicella zoster virus, which we all know. It looks like chickenpox in childhood. The red spots where you can see all over your head, trunk, and neck. And primary infection is called as chickenpox. And recurrent infection, again, the same thing. It will remain latent in trigeminal ganglion. Even the HSV virus is latent in the trigeminal ganglion. And when activated, it can lead to recurrent infection. So, if it is primary, it's called varicella, and if it is occurring due to recurrent infection, it is called as zoster virus. Now, there is a syndrome associated that is called as Ramsay-Hunt syndrome. Now, what happens in Ramsay-Hunt syndrome is herpes zoster reactivation in geniculate ganglion can be seen. So, in the geniculate ganglion, herpes zoster virus is reactivated, and it affects the 7th nerve and the 8th nerve. 7th nerve is the facial nerve, and 8th nerve is the vestibulocochlear nerve. Now, what happens when 7th nerve is affected? When the facial nerve is affected, is it can lead to paralysis. And when vestibulocochlear nerve is affected, it can lead to deafness. Okay. Now we are going to study about Coxsackie virus. Coxsackie virus is also called as hand, foot, and mouth disease. What happens is, on foot or hand, you can see like spots, and it can cause hyperplasia. So hyperplasia can be caused. Now, mostly it affects soft palate, throat, and tonsils. Now we have measles or rubeola. Here you can see small red spots all over the body. And that is the very important characteristic feature of this measles disease. It is called as Koplik spots. Okay, Koplik spots are nothing but little red dots on buccal mucosa. Okay, these are ulcers. Red ulcers can be seen. And this is also mostly likely to occur in childhood, caused due to measles virus. and you can see it in the form of skin rash. Next, you have papilloma. Papilloma are nothing but warts. It can be caused due to HPV, and it can be present either in the form of pedunculated, branched lesion, or sessile proliferation of skin or mucosa. Next, you have Verucca vulgaris. This is a common skin wart. Okay. And this is also caused because of several strains of HPV. And if suppose think these are the fingers, okay, and this person has a Verucca vulgaris wart over here. Now, if he just keeps on rubbing, it can occur on other fingers, and when he comes in contact with someone else, he can spread the disease. Okay. Now you have Condyloma Acuminatum. Remember by which strain Condyloma Acuminatum is caused. You have to just remember it. It is caused because of HPV 6 and 11. And this is a genital wart. And it can be seen as an oral lesion when the person suffering with genital wart, another person who has a sexual relationship with the person having the wart can present with the oral lesion. And treatment is whenever there is high recurrence, you just excise. Now you have focal epithelial hyperplasia. This is also called as Hex disease. And this is caused because of the HPV strain 13 and 32. I like to remember is 1331 and next comes 32, something like that. What happens is all over the mouth, there will be lesions. Like small warts can be seen. So by the name focal epithelial hyperplasia, there is more number of cells over there. But the main advantage of this is prognosis is excellent. So once you know that what it is, then you can just excise it. Now we have oral hairy leukoplakia. We have also studied about this in the mucosal infections in the previous class. If you did not watch the video, please do check out the video. I will link it. And this oral hairy leukoplakia is nothing but you can see like strands of white, like you can see some, you feel like there is hair. Mostly it can be seen on the tongue, and actually there will be a white patch on the tongue. How much ever you try to remove this patch, it will not get removed. And it is usually seen in patients suffering with HIV and Burkitt's lymphoma. So this is mainly caused by Epstein-Barr virus. So let's have a quick review. Now, first we have studied about herpes simplex virus. We have primary, and then we also have a recurrent infection. And when a person suffers with HSV infection, the virus doesn't just go away. It remains latent in trigeminal ganglion. And when due to sunlight stress or immunosuppressive drugs are given, then there is a recurrent infection. Primary infection is pan-oral and recurrent is keratinized infection. Treatment is antiviral drug acyclovir. Varicella zoster virus. Varicella is the primary and the zoster is the recurrent virus. And even here the virus remains latent in the trigeminal ganglion. And here you can see chickenpox is mostly seen in the childhood, which is the primary infection where there is like red ulcers all over the body. And there is a syndrome associated with this virus that is called as Ramsay-Hunt syndrome, where in the geniculate ganglion, if this virus, herpes zoster virus, is activated and it affects the 7th nerve, that is facial nerve, causing paralysis, and 8th nerve, that is vestibulocochlear nerve, if it is affected, can lead to deafness. Next, we have Coxsackie virus, also called as hand, foot, and mouth disease. So you see red ulcers on hand, foot, and mouth, and mostly it is seen in soft palate, throat, and tonsils. Measles or rubeola, main important feature of this disease is complex spots, where you see red color ulcers all over the body, and this is usually seen in childhood. Now we have papilloma. They are nothing but general warts, and they can be caused due to different strains of HPV, and they can be branched or sessile. Now we have Verucca Vulgaris. This is common skin wart, and it can spread from one person to another. Next, we have Condyloma Acuminatum. This is caused due to HPV 6 and 11, and these are the genital warts. So when a person is having an oral sex with a person having genital wart, they can show the oral symptoms. Focal epithelial hyperplasia is also called as Hex disease, where there is warts all over the mouth, and this is caused due to HPV strain 1.3 and 3.2, and the treatment is excision. Oral hairy leukoplakia is where you can see a white patch and it does not fade away. It remains as it is. It can be caused due to EB virus, and this can be seen in the patients suffering with HIV and Burkitt's lymphoma. So please let me know if you have understood today's class, and if you have any questions, you can always leave your questions in the comments below and I'll be very happy to answer them. And if you want me to make any specific videos in biology or dentistry, do let me know. Thanks for watching, and in case you did not like, share, and subscribe, please do so. Thank you.